Okay, so I'm going to be talking about mastitis for our week 2 Simple Minds assignment. So first I'm going to talk about the diagnosis. And for these, in the pink, I use the ATI book. So first the definition. So mastitis is an infection of the breast. It involves the interlobular connective tissue and is typically unilateral. So typically it only affects one breast rather than both. It occurs usually 6 weeks after delivery of the baby and when a normal milk supply is established. And the infecting organism is Staphylococcus aureus. So, who is at risk? So, the population for moms who are at risk is first time breastfeeding moms, and the most infective time for moms is the immediately postpartum period. Some risk factors that can influence moms' risk of getting mastitis is poor breastfeeding techniques, improper latching of the baby, a decrease in breastfeeding frequency due to bottle supplementation, poor hand, and poor overall hygiene. These can all increase her risk of getting the infection. Some testing that can be done are blood cultures to determine what type of bacteria is present, white blood cell count to determine leukocytes, leukocytosis, the red blood cell sedimentation rate, which should be increased, and then the red blood cell count, which may show anemia. Some complications of mastitis is it can proceed to be an abscess if it's left untreated, which is definitely something we don't want to happen to mom. Some signs and symptoms of mastitis are milk stasis from the blocked duct, a nipple trauma such as being cracked or fissured, painful or tender localized hard mass, redness and warm swollen area around the breast, the unilateral symptoms, like I said before, and then a lot of the symptoms actually can appear like flu symptoms, so chills, fatigue, increased temperature. We can have enlarged axillary lymph nodes on the affected side. And then the most common site of the breast to be infected with mastitis is the upper outer quadrant of the breast, and that's due to the different breast tissue. So next we'll look at the incidence. This is where I use my 2 articles. So the first article I found related to mastitis incidences inside the U.S. So this study looked at, they followed 946 breastfeeding women in the United States for the first 3 months postpartum and while they were breastfeeding. Throughout this time, they determined that the percent of reported incidences is as low as 2.5%. However, the percent of moms who are actually infected with mastitis is 9.5%. So that was interesting to see that a lot of it goes unreported. And then the other article I found talked about incidences outside the US. So it looked at Morocco and Egypt, and they tried to look at different risk factors that can influence mom's chance of getting mastitis. So they looked at smoking, contraceptive use, socioeconomic status, menstrual cycle. They looked at education. They looked at jobs. They looked at environmental factors. And in the end, they really showed that the main cause of mastitis is breastfeeding all children and mom not alternating breast during feedings. And they examined 85 cases and 112 controls, and that's how they obtained those results. So the next thing we'll talk about is the nursing diagnoses that I picked, and that was from the textbooks. So I have acute pain related to the infectious process of mastitis, and that's evidenced by increased pain rating on the pain scale. Some goals we have here is to relieve the pain, and that can be done through changing mom's position, frequent pain assessment, and analgesics. And the second nursing diagnosis I did was impaired skin integrity related to the breast infection, as evidenced by redness, swelling, and cracking nipples. The goals here would be to promote wound healing, so we could administer antibiotics to get rid of the infection, prevent spread of infection by using different hygiene techniques, different precautions, and we can make sure that we increase mom's fluid intake to help get rid of the infection and promote the wound healing. Next, I did the physiology and pathophysiology. I used the textbook for this as well. So the mechanism of action, or the pathophysiology, so the source of the bacteria is the baby's flora, and that's how it really gets to mom. So it grows in the retained milk, and it invades the breast through the cracked nipples, and that's how it enters the lymphatic duct. Medications that are used we have two. So we have the antibiotics, which eliminates the infective organism, and then we have analgesics for pain and discomfort for mom. So that could be Tylenol or ibuprofen, depending on which mom prefers to take. And then some other treatments that we have besides medications, we really want to focus on emptying the breast and controlling the infection. So, emptying of the breast, we can do that by having the baby sucking or by manual expression. We want to have mom increase the frequency of feedings, usually every 2 hours, if not every 4 hours. We do not want mom to suppress feedings. We can teach her to use ice and warm packs. And we want to teach her the proper times to use ice and the proper times to use warm so that that doesn't impact her milk supply and how she breastfeeds. We also want to teach mom about proper feeding techniques. We want to assess the baby for good attachment to the breast. We want to make sure that mom really knows proper positions and really how the baby should be latching on to make sure that that's not a cause for the mastitis. We also want to make sure that we support mom and baby through the entire breastfeeding journey and be there to answer any questions as needed. So the focus for treatment is really to focus on reversing milk stasis, maintaining the milk supply, and continuing breastfeeding. We don't want mom to get discouraged and stop breastfeeding. We really want to educate her and explain to her that this is common in women and that there are measures we can take to cure it. And then finally, the nursing interventions, which I use the ATI book for this. So some simple assessment techniques that the nurses can do is frequent vital signs, frequent pain assessment, and monitor skin integrity. And then patient education, which we have quite a few here. And we want to really teach mom about breast hygiene and prevention tips for developing mastitis again, along with breast hygiene, good hand hygiene, frequent washing of the breasts and changing of the breast pads is important. We want to make sure she allows her nipples to air dry. We want to ensure she knows the proper infant positioning for the feedings, the importance of completely emptying her breast during feedings, and switching breast during feedings, because that can also be a common cause of mastitis. Like I said earlier, the frequent breastfeeding every 2 hours, if not every 4 hours at least. We want to make sure she begins breastfeeding with the unaffected breast, and that's to initiate the let down reflex for baby. We want to encourage that she has at least 3,000 milliliters of fluid daily to help really hydrate and get rid of that infection. That can also promote the wound healing as well. We want to make sure she understands her antibiotic and other medication teaching. We want to make sure she knows that she needs to finish all of her antibiotic, even if she's starting to feel better. We need to make sure that infection is gone by finishing all the antibiotic prescribed and taking it as prescribed. And we want to alert her of any signs of worsening condition and when to seek help if she feels as though things are getting worse rather than better. And that is a little bit about mastitis.